And here, my dear friends, is one more video for you. Don't forget to subscribe to my channel and share with a friend. Alcohol every year is linked to more and more health conditions. And, you know, I'm your number one friend. Everyone knows that, you know, no creature more honest with my audience than I am. You guys, let's get down and dirty, okay? Drinking. So that study by MD Anderson Hospital in Texas showed 3 years ago that any amount of alcohol, it's not dose dependent, increases the risk of cancer, especially cancer of the breast. Now, I think sometimes people are looking for excuses in academia to justify their personal discretions. I don't want to be judgmental because I've made many mistakes in my life. And the truth is, you guys, that you can obtain the same benefit as far as the Orex, you know, to keep young, healthy, from grape juice. You do not have to have the alcohol element to have the benefits of the grapes. So again, I think many of these people in academia do a disfavor to the world and their audience by keep pushing alcohol when the exact same benefit can be obtained from grape juice, okay? And such as, you know, cleaner arteries and healthier skin and slowing down the aging process through the antioxidant, the protection against the free radicals, okay? So alcohol is an irritant, and the entire GI tract is affected by it. We're going to talk about different elements, but I want to talk about the direct effect on the GI tract. So mouth, oropharynx, larynx, esophagus, intestines, stomach are all affected by this irritant, which is alcohol. There is no doubt that alcohol increases cancer in all these structures I just named, okay? But alcohol also is metabolized to acetaldehyde, similar to acetone. So it also has an indirect risk on the causation of cancer. Along the lines of alcohol as an irritant, alcohol is extremely irritating to the liver cells. As a matter of fact, it will kill them and your liver will scar. The ducts inside your liver, the more scarred they are, the more bile can damage it. And it will also inflame your pancreas. So you can end up with pancreatitis, which is, as a young surgeon, one of the most devastating diseases I treated when I was a resident. Basically, you have to fillet the belly open, leave the belly open, fill the belly with drains. The patient is literally with the entire abdominal cavity open, drains everywhere, pus everywhere. And the extremely high mortality. But let's take a step back and talk about cirrhosis. Yes, there is definitely an element of genetics, because I've known people that developed cirrhosis of the liver and did not have much alcohol. And I've seen inveterate alcoholics that only at end stage develop the classic signs of cirrhosis, which is the yellow skin, the yellow sclera, the big belly full of water. Let me tell you how we treat it as residents. We tap their belly, just put basically a harpoon, really, to be honest with you, a very large bore needle, and drain the yellow fluid out. But they're basically cooked. They died soon thereafter. To take a little breather, let's talk, and not much of a breather, take a little breather, let's talk about other effects of alcohol. It could have an effect on your nerves. So alcoholics can have a direct effect or your central nervous system, including your mind. Alcohol can cause nerve damage. So you can end up with weakness of your muscles. It can affect your GI tract, your motility, with constipation, incontinence, etc., etc., etc. It is just toxic to your neurons. Okay, let's talk about the central nervous system. There has been a significant linkage between epilepsy and alcohol. So let's say as a child you fell and you hit your head. You already have seizures, right? Because of the scarring in your brain. The seizures medications will not work as well if you drink. And the more you seize, it could actually affect your IQ. However, it has been also directly associated with seizures. Okay? Let's talk about diseases. Yes, diseases. Alcohol has been linked with tuberculosis, pneumonia, but the part that really scares me is the sexually transmitted diseases. It's the argument of which came first, the egg or the chicken. Whatever it is, whatever the causality is, alcohol vastly increases the chances of sexually transmitted diseases, including HIV. So it makes sense. It's just a poison. You're drinking a freaking poison. Let's talk about a little bit about strokes. Did you know that alcohol makes your platelets clump? And you know that causes blood clots. You get a blood clot, my gosh, you know, even the ambulance won't be able to save you most circumstances. So it also can cause heart disease. It's just injurious to your heart. It's just a poison to your heart. And you can get full-blown cardiomyopathy, just damage heart muscle, or you get fibrillation. Fibrillation just means that instead of a clear pump action, your heart does this. So you can develop blood clots inside of your heart, which go right to your brain. Done. I'm not asking you to stop cold turkey. I'm asking you to decrease some. Make a goal to systematically decrease this poison. Look how many families we have destroyed. Thank you so much, you guys. I love you guys very much. Anytime you have a question, right here, Dr. Ray Videos on YouTube. Ciao.